I have to sort of pinch myself now to realize how great I feel, because it wasn't that long ago that I was just feeling so terrible.
Over about 2.5, 3 year span, I saw about 20 different doctors and specialists, and I just continued to go downhill.
Middle school to me is kind of just a blur. I wouldn't remember what I did the previous day.
I couldn't function, I couldn't sit up, the fatigue was so bad.
I'd vomit for 12 hours straight, end up in the hospital. The doctors couldn't figure out what was wrong with me.
They were taking each symptom and giving it a diagnosis and treating each one individually. Well, let's take care of the reflux. Let's take care of the migraine. And I kept saying, but aren't they all related?
Conventional care thinks of the body as different organ systems: heart, lung, kidney, brain. And you try to treat each organ for each symptom. Functional medicine is saying no, that actually our whole body is greater than the heart, than the kidney, than the brain separately. That we should look at this as all as one whole body.
Dr. Kanodia knew how to put it all together and say, if we're having these migraines and this reflux, it must be one thing. Let's solve the problem of what's causing all of this.
I was so relieved, because finally, this is why I don't feel good.
The first question he asks is, how much are you sitting at your job? And I walked out of that first appointment, I realized that this is going to be a lot bigger of a thing. It's going to address sort of my entire body.
He figured out what was in my diet that I had to stop eating.
And then when I started cutting back on those foods, I started feeling better ever so slightly, little by little.
Dr. Kanodia is a true leader in the new medicine that I'd like to call functional medicine.
What small changes can we make that have huge impacts? Let's talk about business. 80% of someone's business is from 20% of their customers. So the same thing applies to health. Intracellular hydration makes up 99% of the body. So you work on that. You work on sleep, where the healing happens. You work on the nutrition, exercise, breathing, the emotions. But do it in a way that is simple and also that gives the most bang for the buck. Small steps, big results. That's the Kanodia MD way.
I firmly believe that some of the work that Dr. Kanodia is doing is going to lead a new army of providers into participatory medicine.
We outline 6 or 8 steps that you can do step by step over the next 2 or 3 months in between appointments with me.
The coaching was very important.
He tweaks the supplements, he might tweak the diet.
He has you sort of take notes with him as you go along.
Tells you like it is. He's upset me before, but I flat out told him, thank you. You kicked my butt. I know I need to get better.
I help to motivate, help to educate, inspire them along the way, and then introduce new things as they're ready.
My goal in my office is to really talk to people about all of the foods that they can eat and that are going to help them heal.
We try to slow it down and kind of take it piece by piece.
It's not just about a temporary fix or throwing a Band-Aid on something. It's all about figuring out what the root cause is, explaining that to a patient so that they want to commit to the process, and then healing.
I started seeing an improvement probably within a few weeks.
Probably about 3 months into it.
Jenna was improving immediately.
One of the key things for me in functional medicine is not per se getting your illness better, but for you to live your dream, you to live whatever it is for you. So if you want to be the best tennis player, the best house mom, the best CEO, whatever it is, if you don't have your health, it's hard for you to live your goals, your dreams, your vision.
I see their energy come back. I see the joy, when they realize that, wow, I'm not sick anymore. I feel great. So.
If I didn't stick with the diet and stick with the supplements, I can't imagine what my life would be like right now.
Well, I'm in progress. I feel like I'm at about 75%, about to become a jazzercise instructor, which has been a dream of mine for years.
It's unbelievable what changing your diet and changing your lifestyle can do that pills can't do.